Broadcasting from the business capital of the world, this is the Podcast Business News Network. And welcome back. We're going to talk about something that affects pretty much all of us in the United States. And many of us have our own opinion about this thing. Lots of challenges come along with that. I'm talking about our healthcare system in the United States and the challenges with that. And we're going to also look at the insurance situation as well. Now, we've got a gentleman who has made it his life's work to focus on healthcare. In fact, he started Healthcare Value Management, where he was the president and co-founder for some years. And even before that, he was still working in that arena. And also was connected to the public section of Boston. He's a great gentleman. Our Centurion recipient, Charles L. Donahue Jr., is back with us on the program. Hi, Charles. How you doing?
Good, Stephen. Great to be with you. How you doing?
I'm good. It's good to have you here. And our healthcare system, anytime that conversation comes up among friends, family, coworkers, it's usually a negative conversation. What's your overview of our healthcare system here in the United States and your first thoughts on what needs to be improved?
Well, it's a very lengthy, complicated question, and it's about to change. If anybody's been reading about the new appointments that are expected with Robert Kennedy, who doesn't believe in vaccines, and it's been questionable whether he has moths or worms in his brain. He's about to become the new Trump-appointed commissioner of health, and he's about to appoint a lot of people. But I think what's important is a recent article in the New England Journal of Medicine, it was just recently published, spoke about the issue of the United States compared with other countries. What's our health system like? In the other countries that it was compared with were Austria, the Netherlands, the UK, New Zealand, France, Sweden, Germany, Canada, Switzerland, and us. And they compared life expectancy and other features about how successful these health plans are. Well, what they came up with was the United States has the lowest life expectancy. In other words, people are living longer in countries. It's a difference by 4 years that their life expectancy, you live longer in these other countries by 4 years than the United States. And there's a lot of concern why this is so. I myself did a study many years ago of why the United States ranked 21st in infant mortality among countries like this around the world. And I did a study on that. I got a paper published in the American Journal of Obstetrics and Gynecology on what we found out. And it was very, very interesting. What anybody can do, you go onto Google and look at infant mortality by state. And there are certain states in the United States that have very, very low infant mortality. The women, very low maternal mortality. But within the United States, there's about 12 or 15 states who have infant mortality worse than developing countries, worse than countries that are very, very high. And they also have maternal mortality, where women die in childbirth. And these states that are the highest in the United States, highest infant mortality, highest maternal mortality, are those states that will not accept Medicaid. Many, many states have allowed people on Medicaid to get access to it free. The federal government pays 90% of it, but these states won't allow women to access Medicaid, which would allow them to get access to early prenatal care and other crucial things to have low infant mortality and low maternal mortality. So I'd suggest people who have any curiosity might go to Google, look at infant mortality by state in the United States, and you'd be surprised to see who those states are that refuse to allow women access to Medicaid, where almost all states, there's only about 14 states left that don't do it. what are the reasons why the United States have low life expectancy, higher death rates, preventable diseases in the United States of high rates? Hypertension, deaths by hypertension, cerebrovascular disease, renal failure. These are the diseases that can be prevented, that we have very high, and it's why our people live 4 years less than the average person. We also have highest excess mortality from COVID. People could get tested, people could get vaccinated. We had the highest rate in the world from COVID. We have high death rates also in the United States, what are considered self-harm. Suicide is among them. We also have the highest assault deaths. These are from gun violence. Some states, you can carry guns, be seen with guns on your holster. So these are just some of the concerns. Now, we do have a health plan. I had a chance to watch it develop in Massachusetts by Mitt Romney. People know is a conservative. He ran for president. He was told when he became governor of Massachusetts that the business community approached him and said, "You got to do something, Mitt, about health insurance costs. Health insurance is hurting business. We're not as competitive as we should be. We can't compete with people in Canada and other insurance costs are far less." Mitt asked the Heritage Foundation, which today is a very conservative think tank. Back in those days, in the early turn of the century, 2000, they were just a creative think tank. They came back to Mitt and said, "Mitt, some of the problems you have in Massachusetts is that a lot of rich people who have their own company, they don't work for a company that offers health insurance. They don't bother with health insurance. However, if they get into a car accident, have a heart attack, have a big expensive bill for hospital care, they don't pay. They become a part of the hospital's debt. The hospitals, every year when they renegotiate their fees with the insurance carriers, all the debt that they have becomes a part of higher fees. So these people who don't pay their bills basically are a part of the hospital's debts. The hospitals then get higher rates from the insurance companies for those debts. So what Mitt decides to do with the Heritage Foundation, recommending it to him, that Massachusetts would have a policy that you have to have health insurance. If you don't have it, the state will come in and take it out of your taxes. So Mitt felt this was very fair to do because these people were rich freeloaders. They didn't pay, and you got to get something from them, and they were rich freeloaders, they would pay more. The second group that Mitch was told about are people who have like 3 or 4 kids. They have health insurance through their company, but it's more expensive if you have 5 kids or 4 kids or 1 kid or no kids. You pay more in your health insurance through your company. So he was told that certain people with a certain income level should be given subsidies because their income is lower. If your income might be less than $50,000, then you get a subsidy to cover the 3 or 4 kids. So Mitt felt this was very fair, that the government would give subsidies to the people whose income was low, even though they had health insurance, and they couldn't afford to pay $15,000 for their health insurance because they have a lot of kids, but they could pay, maybe $3,000 or $4,000. And finally, he was told that there are people who don't have health insurance. They don't work with a company that has insurance. They don't have it. The program, the Health Care for the Poor, and just gave more people access to Medicaid, we could prevent a lot of serious diseases like intensive care babies and other problems. We could cut their health costs for catastrophic things by giving them preventive services, early prenatal care for all of them. So they came up with a new plan that would give you if your income had to be like $10,000 or less for Medicaid, they'd make it available to you if you had an income of $30,000 or less with kids. So those three things became a part of this plan that Mitt came up with. The Heritage Foundation recommended it. These are all conservative principles. We subsidize some people with a few dollars so they can be covered by insurance. We expand Medicaid so there's more people eligible. And finally, rich people who don't have insurance have to buy insurance. So this was the plan. Mitt said, these are great ideas. Conservatives will accept all of these ideas, but in this state, we don't get anything through the legislature. They're all Democrats. So he goes to Ted Kennedy, who he once ran a political office. They were friends. And he said, Ted, would you take a look at this plan? So Ted looked at it, and Ted came back to him and surprised Mitt when Ted said, I'll support this, Mitt, because I once took a look at Richard Nixon's health plan many years ago, and I killed it. I made sure it didn't pass. But then I studied it, and I realized that Richard Nixon had a plan that wasn't perfect, but it was much better than what we had. And I tried to support Richard Nixon's ideas later in the Congress, and nobody could understand me. But what I've learned is that perfect should not be the enemy of the better. So I'm going to support you. So he supported Mitt Romney's ideas in the Massachusetts legislature, and it became the Romney Plan. That's what they called it. It was the legislature passed it. Obama heard about this. He was asking about what can we do about health care. It's really a controversial thing. And he was told up in Massachusetts, they've got the conservatives and the liberals to agree on something. Ted Kennedy and Mitt Romney have developed this plan. So Obama decided to bring it down to Washington, and it became the Obama Plan. And then it became eventually the Affordable Care Act became the National Health Plan. That's what exists right now, and it's being threatened with quite a bit threat to have it destroyed and taken out with nothing better being proposed. So that's how the plan that we have right now. It's not a perfect plan. It has those three components that I mentioned. You could have some states have decided not to make people buy health insurance if they're rich, even though they don't pay their bills, and we all pay their bills for them. That's how hospitals get back their money, but they lose giving health care to rich people free. And the subsidy for people who just need a little help to get their health insurance, and expanding Medicaid. There's 14 states left, as I mentioned earlier, that did not expanded Medicaid. So this is one example of something that's been done. There's other ideas out there. We have people coming forward under Robert Kennedy, who will be appointed to support at least President Trump has said he wants to appoint Robert Kennedy. There's been a lot of stories in newspapers about who Robert Kennedy wants to have running all of the different government agencies that are responsible for many things, including health insurance that we have now, the Affordable Care Act. They're also responsible for doing research on health care. And Robert Kennedy himself has been challenging. He doesn't believe in vaccines. He doesn't believe in a lot of things along that line. And he's about to become the new appointed person in charge of healthcare. So we may be in some rocky, as people follow who gets appointed to run all the government healthcare agencies, and we're already way behind the rest of the world in what we're doing with regard to research in healthcare. We have been a leader in doing research. We will probably give that up in the near future, and we may even have things like vaccines, which have been very helpful for many things, even being challenged. So anyway, that's...
Tell me your thoughts on vaccines, because you did mention at the start that Kennedy apparently is not a fan of vaccines, and it sounds like you are.
He's done a lot of Robert Kennedy did a lot of creative work many years ago on improving the environment, improving things along that line. He's been against preservatives, extra preservatives in food. He has done some creative work in the past. He also has done some very questionable things where he doesn't really believe in science. The vaccines that we've had against polio, when kids are very young, they get access to vaccines. Many school systems require you to prove that you've received vaccines from your physician for mumps and measles and all of these types of things. He doesn't believe in these things. He thinks vaccines cause various types of diseases. So he already believes this strongly, and he is likely to appoint people to run a lot of these organizations. So there's a very good chance that he's a very strong enemy of vaccines, that we will see some people appointed to office if he gets passes the Senate, which he has to do to get the job that he's looking for. But if you just simply take vaccines that are required for school kids, it's common science that everybody in the medical field that understands science accepts that the vaccines when you enter school. He was against getting COVID tests, COVID vaccines. He's against the flu vaccines. Mm-hmm. So a lot of the things that we have been, that most people accept as science and have been opposed by him, and he will become, if he passes the Senate, he will become one of our people who we have to deal with. And vaccines for kids have prevented a lot of diseases. If people remember back in the days of polio, there were people opposed to vaccines to prevent polio. That was a major health hazard for people living in the 50s, where you could get polio, but there was some people came up with vaccines, and although that was controversial, it did save many, many people from deaths due to polio and all kinds of other problems, health problems due to polio. So that's just one of the issues out there that we would be dealing with very soon. And not that we don't have a lot of problems in healthcare, but we will have problems whether health insurance is acceptable, and which ones, what will happen to Medicare and Medicaid. Medicaid will be in trouble. Medicare, everybody seems to be supportive of it because it's for the very politically powerful senior citizen.
Let me ask a question about Canada. People always look at Canada and say, yeah, they got it down. They've got it figured out. Their system is great. Is it? What's your thoughts?
Well, they're not much different from us. You know, they're a bunch of immigrants. Their country is populated. We have a lot of close relationships with hockey players in Canada. We play hockey together with them. We have football. They have football like us. I played in college with a lot of Canadians, played hockey. They're very, very, very similar to us. They're not similar to what I would consider what the southern part of the United States feels. They basically came forward with a health plan that was modeled after many of the things in Europe. They just followed what was going on in England. They're very close to the British in many ways. So that Bernie Sanders is the one that knows the most about it. He's spoken many times about many of his Vermont people, Vermont farmers. They go over and buy drugs over the counter, much less expensive, drugs in particular, where we have been very weak in the United States negotiating discounts for drugs. Canada, the government goes in and says, we're the government, we want a discount on these drugs, they get them. Every country in the world gets discounts on drugs. Pharmaceutical, they get discounts. The United States, we don't get discounts on drugs. The VA, the Veterans Administration, for about 9 million people, 9 million veterans, gets about a 30% discount on drugs. Why? There's 9 million people. They said to the drug companies, we want a discount. The Medicare program that represents close to about 180 million people has never asked for a discount until recently. They just recently got a discount on drugs because they'll get the political support. The drug companies are very powerful politically. They've been able to get strong opposition to the federal government going after discounts because they've been very powerful among one political party that didn't want the discounts on the drugs. So we got discounts for diabetes. People nowadays on Medicare who have diabetes can get a discount on the drugs that they need because finally the drug companies are broken down. And there's more discounts coming in the future, supposedly, for other drugs. But it was all political. In Canada, it's not political because you couldn't get away with it. The government asks for the discounts, they get the discounts. Bernie Sanders talks about his people going across the border to get discounts on the cost of drugs, and the cost to people in their bottom line costs is much less expensive, as it is in every other country in the world. Every other government in the world is getting discounts, significant discounts for drugs, except the United States. And it's a political reason. One political party has been given the drug companies consideration, a lot of political contributions.
Well, it's often been said that big pharma is very strong, to put it lightly, and a big challenge here in the United States. But it's only part of it. I mean, here we are in enrollment period for many healthcare plans, and many states have the healthcare marketplace, which I think it's good if you are getting those credits, but at the same time, challenging if you just want to shop for your own insurance. You know what I'm saying? Yeah. It's and basically they get the discounts that are around what the government can get. It's not like these drug companies each can go in and get a different discount for Medicaid. Right. But for Medicare is what the government can get. That's what is given to all of these groups that are offering health plans. Thank you so much for the insight today, and I know that we went somewhat deep here, but fascinating, interesting on all points, and something so important. We're dealing with it. This is our population. We have to keep ourselves healthy, but it comes back to planning, and that's something that you're a big advocate of, and also data and research. You've been working with that for decades. Charles, thank you so much again for being here today. Really appreciate it.
Stephen, my pleasure to do it, and people need to follow the newspapers. There'll be a lot of discussions of who gets appointed to these different positions and what their positions are, what their histories are, because most of these people that are going to be appointed by Robert Kennedy, if he gets the job as the secretary of HEW, a lot of them already have track records for feeling strongly about things. People need to be updated on what those things are.
Appreciate the heads up, and looking forward next time we get together.
Take care, Stephen. Nice talking with you.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Hey, Dad, how do airplanes fly? What's in this box? Can I touch this? Where does sand come from? Is this tree good for climbing? What happens if I mix these two things together? How are babies made? What does this thing do?
Kids are curious about everything, including guns. Talking to them about gun safety in your home is a good first step, but you can do more. Always keep your guns locked, unloaded, and stored separately from ammunition. Storing your guns securely is the best way to prevent family fire, including unintentional shootings. For more information on safe gun storage and ways to keep your family safe, visit endfamilyfire.org. That's endfamilyfire.org.
What do we keep in the attic? What's this thing called? Can I ride my bike backwards?
Like I said, kids are curious. It's up to us to keep them safe. Brought to you by End Family Fire, Brady, and the Ad Council.